Okay, and now we're ready to go. I'm going to share my screen and we're going to do tonight's talk. Again, I apologize profusely for running late. I don't like doing that. I was having all kinds of technical issues, but I have it going now and we're going to go ahead and do tonight's talk. And I want to thank everyone for joining me. And in case you did miss the beginning of this, it's all going to be recorded, so you'll be able to watch it from the recording. So the topic of tonight is how to avoid surgery by reducing pain. And we're going to talk about regenerative medicine using your own platelets and stem cells. First, I want to introduce myself. I'm Dr. Mark Adelsheimer. I went to Duke University for undergraduate degree. I got my doctorate at the Medical College of Pennsylvania. I did my residency in Tufts University in Boston, where I finished in 1995. I then moved to Pittsburgh in 1996. I joined Dr. Lieber, and I've been working in Pittsburgh for 26 years now. In my spare time, I like to play a little golf. I have two partners, Dr. Lieber and Dr. Sally. Dr. Lieber and I have been together, as I mentioned, for 26 years, and Dr. Sally joined our practice 6 years ago. All three of us are Pittsburghers, born and bred. All three of us are board certified in physical medicine and rehabilitation. And again, we have been here for 26 years for myself. We have different locations around the Pittsburgh area where we see patients. Our main office, however, is in Fox Chapel, and that's where we are going to be doing the procedures that we're going to talk about tonight. So first, let's talk about why you're here. What do you want to talk about? Well, we're going to talk about pain, downtime, avoiding surgery, looking for other options. You don't want to rely on medications. You've been told by a doctor that you need to learn to live with it. You're not ready to slow down, and more importantly, you're trying to improve the quality of your life. So really what we're trying to focus on is helping people improve the quality of their lives, whether it's going out and playing sports from a competitive level, spending time with children or grandchildren. It's really all about how do we make your life better and avoiding surgery in order to do that. So this is an overview of tonight's talk. First, I'm going to talk about RegenX, the different options that we have within RegenX. I'm going to talk about interventional orthopedics. I'm going to talk about the differences that RegenX has. And I will also discuss the type of patients that this is going to be used for and some of the results. So first, let's talk about RegenX and our practice. So RegenX is a national company that was founded in Colorado. It was the first stem cell clinic on earth to begin using orthopedic stem cell use. They started in 2005, and our Pittsburgh office was one of their original providers outside of Colorado. And we had been partnered with RegenX for over 11 years, and RegenX has a national group of providers, but we're the only one in the Pittsburgh region. There are now up to 70 different RegenX providers around the country. Every RegenX provider is a doctor. They're either an MD or a DO. We don't have any physician assistants. We don't have any chiropractors. We don't have any nurse practitioners. It's all physician driven. And everyone is trained in the same way to perform high quality procedures, whether it's prolotherapy, PRP, or stem cell procedures. We were all trained in interventional orthopedics. So it's not a product, but it's a family of medical procedures, but that again define the new medical specialty of interventional orthopedics. So what is the goal of interventional orthopedics? It's to be less invasive, to avoid the more invasive surgery. So how can we treat the same problem that an orthopedic surgeon may be treating, but with a less invasive way, and to achieve even a better goal? To let the body heal itself. Surgical orthopedics will not be the dominant form of care in the 21st century. Most meniscal surgeries have been proven to not only cause problems, but they're also not needed. They actually hasten or speed up the arthritic process. So in addition to not being necessary, they actually make things worse. And this is just one example of multiple different orthopedic problems, but meniscal surgeries, research now is showing that this is not only not indicated, but is actually causing harm. So let's stop cutting stuff out, and instead let's use our biological agents to help heal the structures. So this is kind of a timeline of showing how orthopedics was in 2000, meaning almost everything was done surgically and very little with injections. By 2015, that gap had bridged a little bit, but this is where we're heading, in showing that about 70% of things that were treated with surgery in 2000 will be replaced with injections by 2030. 70%, which is a huge number. So again, talking about interventional orthopedics, this is only talking about high-level qualified physicians. 50% of physicians, when they're sticking needles into you, are doing it blind, meaning that they've had no training in how to stick needles into someone. They just kind of touch the joint and kind of hope they hit the right spot. Another 45% has some low accuracy guided training that they may have been taught during their residency. However, only about 5% of physicians actually are able to use precise ultrasound or fluoroscopy guided, which makes a huge difference in terms of making sure that the outcomes are correct because you were actually injecting the correct structures. So what type of injections are we talking about? Well, at Regenerative, we do prolotherapy, and we also do PRP and stem cells. And I'm going to talk most of the talk about the PRP and stem cells, talking a little bit about prolotherapy when I describe a stem cell procedure. So first, let's talk about PRP, or platelet-rich plasma. Platelets are the healing cells that are found in blood. They help to speed up the repair of tissues. They contain a substance called serotonin that helps to calm down pain. And they also attract stem cells and activate them. So in addition to being the healing cells in the blood, they also work like a fertilizer when using them along with stem cells. So there's two types of platelet procedures that we do. One is platelet-rich plasma, or PRP, and that's used for a multitude of different conditions, especially sports-related injuries, such as tendonitis, for instance, epicondylitis at the elbow, so tennis elbow, golfer's elbow, Achilles tendonitis, rotator cuff tendonitis, partial tears, cartilage injuries. PRP can work very well for more minor orthopedic injuries and problems. We also use platelets when we're treating our spinal injections, and we use something called platelet lysate, and we're using those to help treat the nerve. So if a nerve gets entrapped, such as a herniated disc touching on a nerve causing a radiculopathy, or for instance, a carpal tunnel squeezing the median nerve at the wrist, then platelet lysate is used in those procedures. A huge difference in comparing PRP, or platelet-rich plasma, is what you would get with our practice versus what you'll get at an orthopedics office. All orthopedic surgeons are now doing PRP, but they are using an inferior product. As you can see, the standard PRP on the left is still bloody. It's red because it contains red blood cells. Our PRP is opaque because we're able to eliminate all of the red blood cells and only inject pure concentrated platelets. What does that mean? That means that you are getting a better product, which will lead to a better outcome. So the other cell that we use is a stem cell, or an adult stem cell. Very important to understand that this is coming from you. This is not an embryonic stem cell. What is an adult stem cell? It's an undifferentiated cell that's held in reserve until repair is needed. It can turn into many different cell types. So the same stem cell can turn into a cell that can create muscle. That same stem cell can turn into a different cell that can create bone. That same stem cell can turn into a cell that can create cartilage. So that's what's so cool about using stem cells, is that the same cell can treat a lot of different conditions. It orchestrates a repair response when it's placed into a damaged area. And they are self-renewal. So when patients come in and say, hey, if you take all my stem cells, I won't have any left, the answer to that is no. Much like other blood cells, stem cells do renew on their own. So if we take 1 billion stem cells out of you, within 6 weeks, your body will replenish all of those stem cells. They also provide new blood supply in the areas where they're injected. So at Regenx Pittsburgh, we are talking about, sorry, let me get back to we are talking about adult, again, not embryonic stem cells. These are autologous, meaning that they're coming from you. And we are using bone marrow derived stem cells, not the adipose derived stem cells. So this next slide is going to go over what to expect in a stem cell procedure. It's actually a 3-step process, and I'm going to go through these in a little bit of detail. And I also have a little video showing you the middle step, which is the part that people are always the most concerned about. So the analogy of the 3-step process of a stem cell procedure is like planting seeds in your garden. The first step is done with something we have on our shelf called prolotherapy. As I mentioned, Regenx physicians are trained in prolotherapy. And what prolotherapy is a sugar water-based solution that basically functions to till the soil in the area that we're injecting it. So if we're doing your knee, you'll come in a few days before the stem cell injection. We will inject prolotherapy into your knee under ultrasound guidance to make sure it's in the correct location. And what this will do is it will start an inflammatory reaction, or it brings a lot of blood flow to the surfaces, or like I said, tills the soil, makes things ripe and rich. The second day is the big day, and that's the stem cell day. And that's 2 parts. The first part, which the slide is showing where we get the stem cells from. And we get those from your pelvic bone, which is the largest bone in the body. It's very easy to get a needle onto that bone and very easy to get a needle into the bone. I do have a video showing me doing a bone marrow extraction, which I can go to next. What you can see here is I'm first putting in a needle, and I'm adding some medication right there. I'm looking under ultrasound and making sure my needle is up against the bone, which you can see in the ultrasound in the back. And I'm putting a lot of numbing medication all over that bone. So the bone is nice and numb, and I go in all the different directions. Again, it's very important that you see I'm using my ultrasound machine and making sure my needle is in the correct location. So we put a whole 10 cc's of lidocaine in there, which is a lot, to make sure that bone is good and numb. And once that bone is numb, she will not feel the needle going in next. So this is a needle, which I am going to then get in through the skin. I push it down deeper, and now I pull up my ultrasound probe, and I'm looking at the screen, and I know everyone's not an ultrasonographer, but right there is my needle coming down in the screen, and it's touching the bone. I can feel it, I can see it on the screen that I'm on the bone. I make sure it's in the right location, and then I actually use a drill to get the needle in. And it's just, and the needle goes right into the bone. I'm putting a little heparin in, and then once the needle is inside the bone, and pulling the bone marrow out. And it looks like blood, because bone marrow is, for the most part, red blood cells and other blood cells, but it's also stem cells. It's actually only about 5% of what I pulled out of her is stem cells. About 95% are other cells that we discard and we don't inject into the patient. Let's go back a couple. Okay, so that's what's involved with the bone marrow extract. As you saw, it's a very simple and quick process. It takes 5 to 10 minutes to do. Once we get the bone marrow, we take it to our lab, which is right in our office. And it takes my lab technician about an hour and a half to process that bone marrow. As I said, 95% of it is stuff we don't want to re-inject. So we only want the 5%, the stem cells. We want the pure concentrated stem cells. And then we bring the patient back, put them under an X-ray and ultrasound machine to make sure we're injecting the stem cells into their correct location. So that's why it's a bigger day. It takes about an hour and a half to do that. During that time, our patients leave, they go get breakfast or lunch, then they come back and we do the re-injection into the same area. That's day 2. Day 3 is generally 2 days later, and that's done with platelets or PRP. The reason we put the PRP in after the stem cells is, as I had mentioned earlier, PRP works like a fertilizer or helps to motivate or activate the stem cells to work better. So again, the analogy to the 3 steps is tilling the soil, planting the seeds, fertilizing the seeds. So that's basically what's involved with a stem cell procedure. So the first and most important question is this safe? And the answer to that is yes, this is an extremely safe procedure. As you see, everything I'm doing is done with a needle. There is no knife involved. This is not being done in a surgery center or in a hospital. It's being done in our office. So we have never had an infection with one of these. Whereas if you're comparing Regenex's procedure to surgery, which is done in hospitals where there's a lot of infections that can happen, and other things because people have to be knocked out or anesthetized for these procedures. So things like heart attack, stroke, nerve damage, blood clots, all have occurred with surgery, yet we have had none of these problems. So again, it is an extremely safe procedure. Next, I'm going to talk about the different body parts that our treatments are for, and talking about just some of the most typical things that we see. Again, we treat the entire body, so I'm only going to be hitting the kind of the 3 major joints in the spine, but we also treat things like elbows, wrists, feet, toes, thumbs, and basically any orthopedic condition. But the first area I want to talk about is the knee. And I talk about knees first for 2 reasons. Number 1, it's the most common joint that we do stem cells for. And number 2 is the reason it's the most common is because it's the area that has the most pain, but even more importantly, it does very well with stem cells. So even someone who has end-stage bone-on-bone arthritis can undergo a stem cell improvement and expect to get about a 66% improvement. Age and weight are not a factor. We have done a 98-year-old gentleman in our office. We've done patients who suffer from morbid obesity, and they have done extremely well with a stem cell procedure, even if they have end-stage bone-on-bone arthritis. So when you compare knees to other joints, knees are a home run, especially when you're dealing with severe arthritis, whereas other joints, you have to be a little bit more careful with that. We also treat torn meniscus, as I mentioned earlier. Torn meniscus should not be operated on because it's going to lead to further arthritis later in life. Meniscal tear is very easily treated, often just with PRP. Sometimes we don't need to do a stem cell procedure, but torn meniscus respond very well to our treatments. We can also treat torn ACLs, and I do have a picture of an ACL tear. As long as the sheath of the ACL is intact, we can inject it with stem cells and it repairs itself. So I have a couple of pictures. The first one is from a patient with severe end-stage osteoarthritis. This was Pam. She's a 58-year-old aerobics instructor. She had 4 years of severe knee pain and had grade 4, or the worst grade, because chondrosis is graded on a 1 to 4 scale. Her pain was a 6 to 8 out of 10, and she wasn't working as a result of it. She was not living her life. She was only 58 years old. She underwent a stem cell procedure, and within 3 months, her pain level went from a 6 to 8 out of 10 down to a 1 out of 10. She said that she was 85 to 90% better, and her MRI a year later showed that her arthritis had improved as well. So a very great success story. Mostly in the fact that she was able to get back to work, that she was and with significantly less pain. This is an MRI of somebody with a torn ACL here, I'm showing with my arrow. And this is after a stem cell procedure. You can see that that's nice and black and is filled in like a normal looking ACL looks. This, you can't even barely see the black. This is the PCL, which looks normal, which you can see on both sides, but here the ACL is torn. Here after the stem cell procedure, the ACL has regrown. Moving on to the shoulder, this is probably the second most common joint that we treat. We treat a number of different conditions in the shoulder, starting with the rotator cuff. For more minor rotator cuff problems like tendonitis, PRP works great. But for people that have tears in the rotator cuff, even full thickness tears, can undergo a stem cell procedure and expect to have a very good improvement from that. Other conditions that we treat in the shoulder include torn labrums. The labrum is a deep ring of cartilage and also known as a slap lesion. These respond extremely well to either PRP or stem cells. And then the third most common thing is arthritis. So when you have severe arthritis in the shoulder, you're basically looking at a stem cell procedure, and again, expecting up to 70% improvement for people with severe arthritis. This is another MRI example of someone with a torn rotator cuff pre and post stem cell. Here I already have an arrow showing where the tear is, but afterwards you can see that cuff tendon now has repaired itself after a stem cell procedure. The hip is the third most common joint that we treat, and we basically have two main conditions that we treat for the hip. Actually three, because the labral tear is usually associated with osteoarthritis. But arthritis in the hip can respond very well to a stem cell procedure. However, we have to be a little bit more careful with the severity of the arthritis when we're talking about the hip. So someone who is end stage bone on bone and maybe over the age of 55 would probably not be a good candidate for a stem cell procedure. But someone who has moderate arthritis and is 65, but if it's not bone end stage, can do very well with a stem cell procedure. So I'm in no means saying that it doesn't work for hips. We just need to evaluate you to see if your hip is a condition that we can treat. The other condition that we treat is something called avascular necrosis, and this requires us drilling into the bone and placing stem cells into the bone itself. So when you're comparing stem cells versus a joint replacement, 73% of our patients have returned to active sporting activities. And this is a picture of a needle going all the way into the head of the femur, where we place stem cells for somebody with a vascular necrosis of their hip. The last area I'm going to talk about is the spine, and the spine is something that we treat all the time. It's one of the most common areas that we do treat. Dr. Lieber and I are spinal specialists, and we have been for close to 30 years. Dr. Sally as well, who we do all of these procedures for different spinal conditions. So the spinal conditions can include herniated disc, facet joint pain, spinal stenosis, and people that have had prior surgery. So instead of injecting epidural space with steroids, we are injecting our epidural space with platelets, or the platelet lysate, like I talked about earlier. What does that mean? That means you get a significant, longer lasting benefit. So on average, a steroid epidural, an epidural steroid injection, by 3 months they're gone. By 6 months, they're 100% gone. Whereas a platelet epidural injection, after 3 months, you're having significant relief. So after 6 months, significant relief. Usually those injections last 2 to 3 years on average, as opposed to 2 to 3 months that a cortisone injection will last. So in our practice, we basically replace as many epidural steroid injections with platelet injections as we possibly could do. So how does Regenx stack up to other providers that are doing other, quote, stem cell procedures out there in the community? So let's first talk about the most common providers out there that are doing quote stem cell procedures where they're using amniotic stem cells or they're using amniotic fluid from a pregnant woman. This fluid has been analyzed. It contains no live stem cells. It's really baby urine. And there's also no data to support that it works. Whereas we're using adult stem cells that, again, I've already talked about these, that can turn into many different cells to help heal your tissue. Also, the amniotic procedures are generally done in a chiropractor's office. They're not done under X-ray or ultrasound guidance because they're done by providers that aren't trained in how to do these things correctly. Often done by a PA or a nurse. The cost can be just as significant, and again, no research behind any or no data to prove that any of these things actually work. The other source that people are using out in the community for stem cells are fat, and fat does contain a lot of stem cells. However, bone marrow is a better place to get stem cells because there's much more, and it's also FDA approved. So the FDA has been cracking down on fat. They're now calling fat, if you manipulate it, not an FDA approved procedure. They're now calling it a drug. So again, buyer beware with both fat stem cells or amniotic or cord blood or anything from a pregnant woman. The answer, again, I just mentioned, bone marrow has 10 to 20 times more stem cells per unit volume than fat does. So in addition to the fact that it's FDA approved, it's also a much better product. So in research, head-to-head research comparing fat to bone marrow heavily favors bone marrow. So again, we're able to get about 20 times the number of stem cells into someone that you can get with a fat procedure. The question before, as I alluded to, are my stem cells too old? The answer to that is absolutely not. As I mentioned, your body regenerates their stem cells. So the stem cells right now in your body are about 2 months old. They're not your age. So again, they are not too old. And this is based on peer-reviewed data. Older patients often fare just as well, if not better than younger patients. So what's the downside to all of this? The downside is that for most people, the insurance doesn't cover the actual procedure. There are some companies who are self-insured and they have embraced Regenix. In fact, we have a lot of patients that are coming from self-insured companies. However, most traditional health insurance doesn't cover this, and this includes Medicare and UPMC and Highmark and Aetna. What your health insurance will cover is a consultation with us. So we take every different insurance, and I would highly recommend coming to see us in one of our offices, having a visit with myself, with Dr. Lieber or Dr. Sally. We will do a comprehensive evaluation, and that's all covered by your insurance. We will give you an honest opinion, and then you can make an informed decision as to whether or not you want to go forward with a procedure. Again, if you're comparing knee surgery to a stem cell procedure and you actually look at how much it's going to cost you, and this is what this analysis is showing, it may actually cost you a lot more if you go through your insurance because of the deductibles, the co-insurance, the lost wages, the amount that you're going to pay out of pocket, physical therapy. So there's a lot that goes into making these decisions. These procedures can range anywhere from a couple of $100 to several thousand, depending on what we're talking about. And again, we would go into this in detail with you when you came into the office. So in conclusion, what we're talking about at Regenix isn't magic pixie dust. This is real adult stem cells. It's advanced, precise, safe, interventional orthopedics. Regenerative has been doing this longer than anyone else in the United States, and we have more treatment options than anyone else. We've also published, and we have an online registry, which other people don't have. There are over 80,000 patients in the Regenerative registry. And we spend these resources to stack the deck in your favor. So if you're thinking about doing a regenerative procedure and you do some research, you will realize that Regenerative is a place to do this. So how do I get started? It's very simple. Just call our main number, which I have on the next that slide, 412-963-6480, and just say that I'm interested and I'd like to make an appointment to see one of the physicians. We will make a new consultation for you to see either myself, Dr. Lieber, or Dr. Sally in one of our office locations. We will give you a full and comprehensive evaluation, which will include a history and physical. We'll review all of your imaging studies, which may be x-rays, MRIs, CAT scans, and alike. If you don't have these, we can order these for you. We will give you an honest opinion. I would say of the patients that come in looking for stem cells, about 50% are stem cell candidates. So, a lot of people aren't for one reason or another. We will let you know exactly whether or not this will work for you. And if it's not, we may have a lot of other options for you as well. Again, we have been physicians in the Pittsburgh area practicing non-operative orthopedics, pain management, and regenerative medicine for close to 30 years. So we have a lot of different things that we can share with you. I just wanted to also briefly mention that Regenerative does make various supplements that we have in our office, a stem cell support supplement, a fish oil, a turmeric procurement mixture, and if you are interested, we can have these for you as well. So again, the next step is to schedule a new patient exam. I'll leave that number up again, 412-963-6480. You can also go to our website at regenxpittsburgh.com. And we look forward to seeing you in the office. So I'm going to stop sharing my slides, my screen, and I will open up to any questions. And again, I do want to apologize for the delay today. And if you didn't catch us live, we certainly can look at it because we're recording it at a future date. So have a few questions here. The first question says, how many stem cells generally are in the bone marrow extract? On average, we see about 1 billion. And we do have a stem cell counter right there in our office. Takes them a long time to count to 1 billion. That's kind of a joke, but it's an automated counter. But we've had up to 4 billion. The critical number that we like to see is 300 million. And of the close to 3,000 patients we've done, we've only had one patient that didn't hit that 300 million, that we had to go back in and get some extra bone marrow. So almost everybody has enough. It's really never an issue. But again, on average, we're seeing about 1 billion stem cells per draw. Will the bone marrow stem cell regenerate knee cartilage? Well, that's a very good question. The main thing that stem cells do is they help to create a healthy environment within the knee. They're not going to regrow all of the cartilage that you have lost over the course of your life. They will regrow some of the cartilage, but more importantly, they change the biochemistry of the joint. So you go from a toxic environment to a healthy environment. A healthy environment doesn't hurt and performs. So what happens to our patients is after the procedure, they get a healthier and stronger knee that will grow back some of the cartilage. But again, it's not going to regrow all of the cartilage that you were once born with, because we are using adult stem cells. There is no condition, there's no treatment like that anywhere in the world. Even using embryonic stem cells, which is not FDA approved and not legal, doesn't do that at this point. One of the other follow-ups to that is, and this is very important to note, that if you do undergo a stem cell procedure and have a good result, the question is, how long will this last? If you're not regrowing all the cartilage, it's only going to last me for a few months. And the answer to that is no. Regenix recently published 5-year data that showed that people who were better at 6 months, 95% of them were still very good at 5 years. We don't have 10-year data because we don't have enough patients that have 10 years out. But I know from some of my early patients that this is lasting 10 years for a lot of people. So it's not a situation where you get better in 6 months and a year later you're right back to where you started. Then it wouldn't be worth doing. We know this lasts for multiple years. Next question is, what is the downtime for the knee? The only downtime with our entire procedure is between step 2 and step 3, which is 2 days. By downtime, that for those 2 days, we do put you on crutches or a walker if you can't use crutches, just because we want to protect those stem cells. After we do the 3rd injection, you go about your normal activities, including walking. We start you in physical therapy a few days later. The knee isn't better yet because we're trying to regrow and make a joint healthy. Just like when you plant seeds in your garden, you don't have flowers the next day. It takes, several months before you note significant improvement. But as far as downtime, within 1 week, you're right back to where you were before we started the procedure. So there is little to no downtime with this procedure. Our patients that are working literally miss 2 days of work and that's it. And then they get right back to work. Our bone marrow treatment, next question is your bone marrow treatment different than other clinics that perform the same or similar treatment? Yes, it is very different in 2 regards. Number one, most clinics that use bone marrow are taking the bone marrow out and are re-injecting that bone marrow right back in. They do not have the lab where they are able to concentrate and put in pure stem cells. So as I mentioned, we're getting rid of 95% of the bone marrow because it's not necessary and it doesn't help. We're only putting in the good 5%. That's one reason why ours is better. Number 2 is we have the precision X-ray and ultrasound guidance to make sure we're putting these in the correct location and extracting them correctly. So it definitely makes a difference if you're doing them correctly. But most importantly, it's the quality of what we're re-injecting. You're going to get a significantly better quality product into your knee, into your hip, into your shoulder than you would get at another clinic using bone marrow. Are there any other questions? I'm not seeing any other questions today, so I want to thank everyone for joining. Again, I want to apologize for the delay at the beginning. And again, my message to everyone tonight, the bottom line is just come and see us in our office. It's covered through your insurance. You got nothing to lose by making an appointment, and you'll get a good, honest opinion, and we can talk in detail about what your problems are at that point. I want to thank everybody and have a good night. Bye.